Hi, my name is Hans Lee. I'm an assistant professor at MD Anderson Cancer Center in Houston, Texas. And today I'm going to be discussing the role of belantamab mafodotin in multiple myeloma patients with renal insufficiency. This is based on some updated data presented at the ASCO 2020 virtual annual meeting. So just a little background, belantamab mafodotin, otherwise known as belamaf, is a BCMA antibody drug conjugate that's been evaluated in both phase 1 and phase 2 studies in patients with relapsed refractory multiple myeloma. Notably, the DREAMM-2 study was a pivotal phase 2 registration study that enrolled patients with at least 3 prior lines of therapy, including those that were refractory to proteasome inhibitors, IMiDs, and who were refractory and intolerant to anti-CD38 monoclonal antibodies. The patients who enrolled in the study were then randomized to receive 2 different doses of belantamab, either 2.5 milligrams per kilogram or 3.4 milligrams per kilogram, administered every 21 days. The primary results of the study were recently published in Lancet Oncology, which basically showed that the overall response rates with belamaf at 2.5 milligrams per kilogram was 31%, and 34% in patients dosed at 3.4 milligrams per kilogram. We know that renal insufficiency is common in multiple myeloma patients due to the nature of multiple myeloma and how it can affect the kidneys. And so we want to know if there were any differences in outcomes in patients with renal insufficiency who received belantamab in the DREAMM-2 study compared to those with normal renal function. So in order to answer this question, we performed a post-hoc analysis looking at patients who were dosed with belamaf in the DREAMM-2 study based on subgroups, based on renal function. So there were 3 subgroups assessed in this post-hoc analysis. So the first subgroup were patients with normal renal function, defined as a glomerular filtration rate of at least 90 milliliters per minute. And this represented about 1/4 of the patient population. The second subgroup were patients with mild renal impairment, defined as a GFR of 60 to 90 milliliters per minute. And this represented about 1/2 of the study population. And finally, the third subgroup were patients with moderate renal impairment, defined as a GFR of 30 to 60 milliliters per minute. And this represented about 1/4 of the patient population. It's notable that patients who had a GFR of less than 30 milliliters per minute, which is defined as severe renal impairment, or patients who were on hemodialysis were excluded from the DREAMM-2 study. And what we found was that patients with mild to moderate renal impairment compared to normal renal function had very similar overall response rates, duration of response, and progression-free survival in this post-hoc analysis. And just as importantly, the safety profile was also generally similar in patients with mild to moderate renal impairment compared to normal renal function. There was a little bit more anemia and thrombocytopenia in patients with mild to moderate renal impairment compared to the general population and compared to those with normal renal impairment. But other adverse events, such as keratopathy, which is a common side effect in patients with belamaf, or albuminuria, were similar in patients with mild to moderate renal impairment compared to normal renal impairment. So this study, this post-hoc analysis was important because it did show that the safety and efficacy of belamaf in patients with mild to moderate renal impairment was similar compared to those with normal renal function. And so given the fact that renal impairment is common in patients with multiple myeloma, this does represent a potentially important therapy in this patient population. What we don't know is the safety and efficacy of patients with more severe renal impairment. So these are patients with, again, a GFR of less than 30 milliliters per minute, or patients who are on hemodialysis, since they were excluded from the DREAMM-2 study. And it's important to note that belamaf is not renally metabolized, so it's very well possible that this could also be an important therapy in patients with more severe renal impairment, but future studies are needed to assess and evaluate this question moving forward.